Depression is a withdrawal symptom. Your body produces this drug called endorphins. Endorphins are endogenous opioids. They are released during pain, stress, and pleasurable activities. The effect is to relieve pain, to generate a sense of well-being and euphoria. Your body can get addicted to its own opioids when the tolerance level increases. When you're exposed to high levels of endorphins, the opioid receptors in your brain have enhanced binding. If you're someone in constant pain or constant stress or goes through some huge event or else are constantly surrounded by pleasurable activities, your endorphins are going to get used to that and you're going to experience a crash after. That is depression. One example is postpartum depression. So pregnancy releases a huge amount of endorphins, and these could stay in the system for days or weeks, and then suddenly there's a crash. This is why you have adrenaline junkies and thrill-seeking behavior, because they're trying to release more endorphins because their tolerance has gotten higher and higher. When the tolerance level is higher, the amount of endorphins needed to reach that same level of euphoria increases, but it also means the crash is even worse. People may turn to drugs to replace the endorphins, or they may hurt themselves or other high-risk behavior in order to get to that same level of endorphin release. Of course, over time, this makes the rebound more and more extreme, meaning lower depressions and greater highs. But because depression is a withdrawal phenomenon, that immediately changes the perspective on depression. Depression may lead to a sense of hopelessness, a sense that this will last forever, and a self-blaming, destructive attitude. Those are the withdrawal symptoms talking, and they're saying that you need this or you're going to continue to suffer and it's going to get worse and worse. Because withdrawal symptoms are so strong and they cause that sort of delirium, it pushes the person into the next fix. The brain gets its opioids, the tolerance increases, and the cycle repeats. Like any other withdrawal symptoms, you kind of just have to let your body and brain recalibrate, let it rebalance itself, and let the tolerance levels lower. It's also important to understand that endorphins can be greater at pain relief than even morphine. So whether it's extreme stress or traumatic situation or intense pain or lifelong chronic pain, or if you're always surrounded by pleasurable activities, or even being on cloud nine with romantic endorphins, whatever the case may be, the underlying problem is withdrawal symptoms from those endorphins. And it may seem like there's 100 other things going wrong, or you start blaming other things or blaming yourself, but it is withdrawal symptoms. Just knowing this could be huge, as I think a majority of people are in this endorphin rebound cycle of withdrawal phenomena and depression, which could manifest in a number of different ways, but the underlying problem is this endorphin tolerance. We're always seeking this next fix of our endogenous opioids, that all the little and mundane things around us are seen as meaningless and we neglect them. It's only the sensational stuff, the shocking stuff, the doomsday, the controversial, the rage. Those are all the things that we want to get because it's the only thing that can give us endorphins anymore. We've literally become addicted to our brains. It's, for lack of better words, it's become very masturbatory. And this only becomes more and more extreme because the tolerance keeps increasing. The fallout from that is more and more depression, which leads back into the next fix. And then, of course, depression is seen as a disorder or a problem with you and not a withdrawal symptom, and that makes all the difference.